First at 5 o'clock, hospitals in West Michigan are preparing for the potential spread of coronavirus here in the U.S.
Just days ago, the CDC says it's not a matter of if, but a matter of when. Our Michael Martin joins us after hearing from doctors who say they're ready regardless. Michael.
Yeah, Doug Annie, the director of emergency preparedness over at Spectrum Health, tells me they actually started discussing plans about 7 weeks ago. She says that while the possibility of a coronavirus emergency here in West Michigan is certainly worth preparing for, they've been through this routine before.
We've gone through this a couple of different times with H1N1 and Ebola, and we really have just taken our plan from previous incidents and implemented it right now.
As concerns over the spread of the recent coronavirus continue to grow, hospitals in West Michigan are facing the possibility of an impending stateside outbreak head-on.
Our infection prevention team is always watching situations like this, and when they get to the point of saying, you know, this is going to happen, we really need to connect and we really need to start planning.
So while there are still only a handful of confirmed cases of the virus in the United States, healthcare providers like Spectrum Health are planning for a worst-case scenario.
If you walked into our emergency department waiting room or the urgent care centers or even into the physician practices, you'll see a sign there that says, stop. If you've had any international travel within the last 14 to 30 days, please make sure you let us know, and then we give those patients a mask.
Director of Emergency Preparedness for Spectrum Health, Julie Bolson, says ultimately the goal is to isolate those who are infected.
If we can do anything to keep these patients at home without coming into the emergency department with that potential spread through a waiting room area, that's what we want to do.
So keeping patients showing symptoms away from others and utilizing phone-in medical services when possible.
If they need to have labs drawn, we've developed a process where we can send a home health nurse out to actually draw the lab. So again, the patient doesn't have to come into a public environment.
Bolson says, fortunately, consistent hygiene habits will help protect us all from the coronavirus as well as other illnesses like the flu.
So it's making sure that if you're sick, you stay home, that you wash your hands, and don't touch your face. Don't touch your eyes, things like that. So that will help contain that disease.
Now, I also reached out to both Mercy and Metro Health, who are also implementing similar plans of action, screening patients and keeping their preparedness plans up to date based on the latest info available. For now, live in the newsroom, Michael Martin, Fox 17 News.
Michael, thank you.